Today we have a very remarkable guest, Rohit M.A, who is the founder of Cloudnine Hospitals. Today the chain has over 40 hospitals and employs about 4,000, 5,000 odd people. He is the founder, general partner of Pure Capital, and he's a career investor now. Let me qualify that question. What business did a 26-year-old computer science engineer has been building a hospital chain?
Yeah, no, actually nothing much, but just took it up as a challenge.
For how long were you guys bootstrapped before you raised the first institutional capital?
6 years.
For 6 years you bootstrapped, wow. And when the three of you started Cloudnine, what was that one core insight which led you to zero down on the idea?
Largely looking at how things were done elsewhere, how things were happening here. Pregnancy is something in healthcare specialty which is not illness, it is wellness. I think we had the sort of courage to actually be able to do this.
I was also going through one of your interviews where you said that you spoke to Doug Leone and Sequoia and the discussion was around how to make it McDonald's.
Yeah.
What were the elements of standardization that you pursued so that the experience that I get in Cloudnine Bangalore versus Cloudnine Gurgaon is the variance is low?
Yeah. No, so I think honestly Vivek, that's a continuously evolving playbook, right? Obviously we started from a place where it was largely led by personal intuitions on what will work, what will not work. But slowly we started listening to a lot of our customers and started incorporating a lot of those. But the playbook in itself was about saying, okay, one was standardization in terms of what is the size of the facility? How do we kind of rationalize that? How big or how small should it be? Thinking about throughput, to thinking about capex, but from an ops point of view, because that's where we were different.
What I also observed in your story is that you got time to perfect the model, focus on the processes, focus on EBITDA. There's naturally a fear of somebody else taking away market share from you if you are guilty of growing too slowly.
Yeah.
How much of that is a factor now?
Our philosophy is if there are great corporate hospitals in a specific locality, we'd love to go ourselves and plant there.
And how many times do you let your gut feel prevail over what your framework is telling?
Yeah, well, for me it's 100% gut.
Healthcare is still a sector which is where largely the input is human capital, right?
Yep.
Now, if you look at all macro level data, the number of hospital beds per 10,000 population or the vacancies in hospital, it would logically lead you to believe that just because of demand supply mismatch, the wages should go up or there should have been a lot of focus in terms of skilling. Do you believe that we as a nation have done a decent enough job? If not, why?
I think existing infrastructure is just not enough.
You mean the education pipeline? People
yes,
coming out
on all forms of skilling, right? I think all of us know in terms of what's the throughput, what's the demand, what's the supply. But somewhere I don't think these numbers add up in terms of, as an input criteria at least. Unfortunately, this sector has also been something which has only thrived upon tenure as an asset than skill as an asset, right? When people actually jump jobs and everything, right? For doing more of the same, you get paid more, right? So I don't think that should exist. There are a lot of several initiatives across government and also like the fact that what you guys are building at Emversity, it is still green shoots, right? But I think this will go a long way to kind of ensure that quality is high without, someone having to say that every time you associate a premium with something like this. So I think it is very needed. It's a huge gap in today's day and mind, right?
We already know that your most favorite investment is Emversity, but why don't you talk about some other spaces that you're really excited about?
Anything which has a good flavor of tech, which is across a lot of consumer tech plays. By that I mean health is a part of it, fin is a part of it, B2B enterprise, B2B SaaS is a part of it. Gaming is a part of it. So we right now, the sort of sectors that we've kind of rationalized with is where we feel we have a higher right to win in terms of our primary network and our ability to work alongside founders.